Thank you. I'm Jody West, and I'm going to speak today about maternal mental health in rural communities. Next slide, please. So I am with the provider to provider consultation line. We are federally funded through HRSA to provide mental health consultation to non-mental health providers throughout the state of Louisiana. So I'm going to talk a little bit about the why we exist and then the how we can help. So I am a social worker. I have been with multiple programs across the state. I did work with Well Ahead with Tanya and Chrissy and other avenues, but I wanted to talk this morning just about the programs within the Bureau of Family Health. We are within the Department of Health, Office of Public Health, Bureau of Family Health. That's where we live. That's where we end up at the end of the day. Next slide, please. So our objectives today is just to learn about the challenges that Louisiana's pregnant and postpartum population have with, especially around mental health services, and then to learn about some measures that the state has put into place to try to address that. Next, please. So why do we need this program, or why do we need assistance? What are the disparities that exist, or the realities of our population, our pregnant population, our postpartum? We all know the statistics, or we should know that Louisiana consistently ranks at the bottom for many, many things. For women and children, we are 50th. There are mental and behavioral health disparities, especially when it comes to different racial and ethnic groups across our state. And I do have, I know it's very hard to read at the bottom, but I could provide all of these resources to you. 32% of children, so we're going to go back and forth between children and pregnant because our program serves both populations. 32% of children aged 13 to 17 have mental, emotional, developmental, and behavioral disorders in Louisiana that's diagnosed. And then 2 times the number of youth attempted suicide compared to the nation. So in Louisiana, we have a very high percentage of youth that attempt suicide. In Louisiana specifically, overdose is the leading cause of pregnancy-associated deaths. And I sit on the PAMR committee, which reviews deaths of pregnant and postpartum up to a year in the state. And so we see a lot of instances of overdose being the reason why there is a fatal outcome for the birthing person. Some things to keep in mind, mental health problems are common. They affect up to 20% of women in the perinatal period. And perinatal, just to clarify, is pregnancy up to 1 year post-birth. That's considered the perinatal period. It is under-identified, even though it's common. Studies suggest that less than 50% of women with perinatal mental health problems are identified by their frontline physician, and it goes mostly untreated. 75% of patients experiencing perinatal mental health symptoms go untreated. So it definitely is relevant to this group. I'm sure you have had experiences with this if you live in Louisiana and are in a rural community and interact with patients or with just your neighbors and maybe within yourself and your family. This is a serious problem that is directly affecting the health of our citizens. Next slide, please. It is not just a problem in Louisiana. The United States is failing moms. Louisiana is in the top 6 states that have maternal mental health dark zones. The parishes that are on this chart are, what this shows is that this is the number of providers, mental health providers that would be needed to meet the recommended ratio. So for example, Jefferson Parish would need 21 more mental health providers to just say that they have adequate resources. Just to throw in the additional data, if we look at data from the Department of Health, the top 5 parishes that have opioid prescriptions are Rapides, Caddo, Lafayette, East Baton Rouge, and Evangeline. They're the parishes where most opioid prescriptions are going out. If we look at opioid overdose deaths, Jefferson, St. Tammany, Lafayette, Livingston, and Orleans are the top ones. So not only do those have the highest rates of death, but also they have the fewest, there's some crossover between the availability of services. And the reason that I'm bringing in opioid abuse is because that is the number one substance that's leading to the high rate of death. There are other substances which people are using, but that is what most commonly leads to there being a death from an overdose. Okay, next slide, please. So going back to just the disparities that do exist, even though 39% of women that give birth are classified as Black, 68% have death. Or they account 68, Black women account for 68% of those women that do die during childbirth. So, I'm sorry, not during childbirth, during that period. So there's an obvious disparity, or it's very clear that there is something happening where Black women are 4 times more likely than white women to experience pregnancy-related death. And again, that's the death between pregnancy and up to a year post-delivery. And Louisiana ranks 40th in the country in infant deaths. So not only are we losing Black mamas, we are also losing infants. They're twice as likely to die than white infants. So this is from the 2019 PAMA report. We are currently looking at 2020 data, or actually I think the 2020 data has already been evaluated. They just haven't published the report. And then the committee right now is looking at 2021 data. So this just shows that the disparity is quite substantial. Well, it exists, that is quite substantial, and it needs some attention for sure. Next slide, please. So part of the problem when we're talking about mental health and substance use disorder assistance, so behavioral health includes mental health as well as substance use. Louisiana, the entire state, is a mental health professional shortage area, regardless of if the client or patient is seeking services for ADHD or for depression or for substance use treatment. The entire state is a shortage area. And this, some parishes, most parishes, if you look, are not only a mental health shortage area, but they also have designation as being rural, which then has less resources, and also having a low income population. Those are all 3 different measures. And so no parish in our state has adequate services. Next slide, please. So to respond to this, one of the strategies is how do we, as a country, we can't, or we could incentivize additional training for mental health providers through college, like, tuition programs, student loan repayment, but that will take years and years to get the folks in, get them trained, get them practicing and getting into the communities. So what HRSA has done across the country, really over the last 20 years, is just Louisiana is late to the game, is that they've provided some service funding for pediatric mental health care access programs, where pediatricians or pediatric providers can get access to mental health consultants to help start intervention for their patients in their office while they're on a wait list, while they're waiting for further evaluation, while they're waiting to get in with a mental health professional. Intervention can start there instead of it being a crisis response situation. So that's what the blue states on this map show. Louisiana was one of them. We were awarded in 2021. So we are in our, we've been operational for 2.5 years. Our call line has been operational for 1 year. It was November was a year. But then last year, HRSA also had additional funding to expand to maternal mental health consultation. And so Louisiana is only one of, I think, 14 states that has both pediatric mental health care access as well as maternal mental health care access. And that's because our needs are so great. Next page, please. So what does this program do? Louisiana had a program called LAMP, Louisiana Perinatal, Louisiana Mental Health Perinatal Partnership. That was the acronym. That was through Tulane. That it had a 5-year grant, but it wasn't widely used across the state. So when the pediatric funding was awarded, that's where we started. And then when the funding for the maternal mental health access ended, we applied for additional funds and were awarded those maternal mental health, and they had a special focus on substance use disorders, and we merged that with PPCL. So in the state, we have 2 different federally funded programs, but they're merged under PPCL. That's the overall program. So the provider to provider consultation line, again, is not patient facing, it's not public facing, it's for providers. And when we say providers, we're nurse practitioners, physician's assistants, physicians, social workers, community health workers, anyone that provides services to other folks. They can reach out to us and get guidance or suggestion or education or resources. So we have 3 different services that we can provide. It's the consultation, where someone calls we have a toll-free statewide line that's staffed business hours of Monday through Friday, that they can call with a question, concern, about what they can do for their patient that's presenting to them with a mental health concern. Because again, remember, these are pediatricians or family physicians, or it could be a certified nurse midwife, OBGYNs, that they are trained professionals, but just not in mental health. So they can call and get access to a mental health specialist and ask whatever the question may be. Sometimes it's that they're thinking about starting a medication for an 8-year-old that has anxiety, that is not wanting to go to school, and they're on a wait list, and it's 6 weeks before they can get into the therapist, and the school doesn't have a social worker, and there's no school-based health center. So what can I do? Well, we will then connect them to a child psychiatrist that can work with that provider, that prescriber, through how to either initiate medication or change a medication, or just talk through the treatment that can be provided for that patient in their office immediately. The person that answers our phone line they're all mental health professionals. So if that physician would have called and not already had connected that patient to therapy or mental health resources or the school system, then that social worker can work with that provider. So not about 70% of our calls don't go to psychiatrists. It's not about medication, it's about resources. And that's our next service, is resource referral and support. As you know, living in Louisiana, there's not always a lot of availability of services. So that is something that we are trying to help with. We don't take over the care of the patient. We don't provide a warm handoff, but we can help you to help your patient navigate it. And then we also do education training. We have our own echoes. We do an echo on perinatal mental health as well as pediatric mental health. Next page, please. So why are we putting more on our physicians and our frontline healthcare providers? Well, that's where patients go. We see that most patients, when you're talking about pregnant and postpartum patients, they will take their child to the pediatrician more often than they will see their own provider, whether their own primary care provider or their OBGYN. It's usually time limited. So when we work with pediatricians or providers for children, we also can help them with their caregivers' needs, even though that person is not their patient, the child is their patient. And that's why one of the reasons we decided to integrate the programs together instead of them being separate. Frontline health care conditions are usually trusted by the family. The family is likely to go to that provider when they need assistance. And so through the different aspects of our program, we hope to increase the capacity of that frontline healthcare provider for that patient, but then also for the future patients that walk in that may have a similar scenario. Next page, please. So we are statewide. Pediatric is considered birth to 21, and then pregnant postpartums, again, is 1 up to 1 year postpartum, 8 to 4:30 Mondays. We do ask people to register, but that's just so we can report to HRSA about it. It takes 3 to 4 minutes. We have to report who's utilizing us. We can always see if this is the best route. People can call. There's no obligation. There's no charge. We don't take the patient's information. So you don't have to get consent from the patient to contact us. We're really just a resource for those providers. Next page, please. So just to simply walk you through what it would look like, a provider has a question. They don't have to register. We can register them when they call, but we'll offer that up to you. We also have an online submission. So someone could go and enter it through our website if they don't want to call. They can also email us. And if you scan that QR code, you can go ahead and register for PPCL. And then what happens then, if you register, we'll include you on our newsletter and emails to let you know what's going on with our program. So that's our number, that's our hours, that's a link to our website. And then we will respond. The phone rings, we answer, and we hope to get information back to you based on your question within the next business day. Next page, please. Here's our psychiatrist. We do, like I said, the person that answers the phone is a mental health professional. We have a very widely trained team, and we are cross-training constantly. Here's our psychiatrist that we could connect the provider with. Their specialty is Dr. Waldman is pediatrics, and then either Dr. Finelli or Dr. Vincent are both trained with perinatal mental health. Next, please. So the idea behind this is we teach one person. This is how consultation works, right? We teach this one physician can impact their patients. Next slide, please. Oh, did we skip one? Maybe I took one out. Can you go back? Go back. Huh. Okay, sorry about that. Well, the idea behind consultation is one provider can impact their patients, but with us, with consultation, we can impact multiple patients by working with our providers. So here's the type of questions that consultations have been about. Next slide, please. And here's our ECHO series. Next slide. That's the pediatric one. Then the next one is our perinatal. That's the topics and the presenters and the dates. Next page, please. I know we're short on time. So if you scan that, it'll bring you to our website as well as to help you register. If you want to just look and see if there's more questions that you may have, because I know we haven't had any questions yet. But next page. So that's our website. That's our phone number, and that's our email. Next, please. So I'd be happy to answer any kind of questions you may have. I'll flew through a lot of material.